Hi, I'm Dr. Mark Fryman, the Chief of Hepatobiliary and Pancreatic Surgery at St. Joseph Medical Center here in Towson, Maryland. We are continuing our medical tutorial Whipple procedure series. Today's medical tutorial is on pyloric preservation, or as some places call it, mini Whipple. And the question is pyloric preservation or this mini Whipple procedure better than the standard Whipple procedure? So just a quick review as to what we're really talking about. I don't like the term mini Whipple because it really implies to the public, to the consumer, that it's really that much more mini, which it's not. Let me draw the stomach here. This is the stomach, and the stomach has a pyloric valve right here, pyloric valve, before it enters the duodenum. So the pyloric valve is a pressure valve, and it opens to release food after it's been mixed in your stomach. This portion of the stomach is called the antrum, and this is called the body. In a standard Whipple procedure, the surgeon actually removes the antrum of the stomach in addition to the head of the pancreas, which is here. And removing this extra piece of antrum is not a significant amount of more work, maybe 10 minutes at most. And it really isn't that much of your stomach. It's anywhere from 20 to 30% of your stomach. So that's really the difference when we talk about the pyloric preservation. Whipple is when the whole stomach is preserved, including this pyloric valve. So the only real difference, and like I said, this is the mini Whipple and the standard Whipple are so similar with such little differences that it's kind of crazy that some centers make a big deal out of it. So essentially, if you preserve the stomach and pylorus, the reconstruction, as I've shown in different videos, the pancreas may be here, and then the biliary system here, and then the stomach is placed back in continuity with the intestinal tract in a similar fashion. And the theoretic advantage of having the pyloric channel here is that the pancreatic and biliary contents don't reflux into the stomach. That's certainly one of them, but they continue down their merry way into the small intestine. The other theoretical advantage of preserving the stomach, or the antrum of the stomach, is that there may be better digestion of food. The antrum does have a function. It helps actually mix the food back and forth between the body and the antrum. And not until the food is more liquefied does the pyloric valve relax and allow the food to exit the jejunum. Theoretic advantages of removing the antrum are that the acid load from the stomach is decreased, and that there may be less ulcer formation because of the acid in this area. The other problem that I alluded to or mentioned is that some of these contents without the pyloric valve can reflux into the stomach, and if you have poor motility of your stomach, you can get bile reflux, esophagitis. So if a pyloric preservation Whipple is not done or not performed, the antrum of the stomach is removed, and then there's a staple line here, and most surgeons will make an opening like this, and the anastomosis is sutured in this fashion. Because there is no valve, there can be reflux of bile and pancreatic fluid into the stomach. Other ways of reconstructing it, if a standard Whipple is done, is with a roux limb, where the biliary pancreatic limb is actually downstream from this anastomosis. In other words, this portion would be actually sutured 30 to 40 centimeters down into this area here, bypassing the stomach, and therefore avoiding bile and pancreatic fluid that going into the stomach. So the ultimate question is, well, which technique is better? Is there any difference? The best thing to do is to review the literature. There are some retrospective studies rather that show that the nutritional status may be better with pyloric preservation. We at St. Joseph Medical Center tend to use pyloric preservation because the operation is a little bit easier and because less bile reflux. Delayed gastric emptying or gastroparesis is common after Whipple surgery. So the only level 1 evidence entails looking at not retrospective data, but prospective data. And there is a multi-center prospective randomized trial that was published in around 2004 to 2005. This study was published in the Annals of Surgery, and it was entitled Pyloric Preserving Pancreatic Duodenectomy versus Standard Whipple Procedure, a prospective randomized multi-center analysis of 170 patients. The conclusions of the study were that there was no difference in operative time, blood loss, hospital stay, morbidity, or even incidence of delayed gastric emptying. There was a marginal difference in postoperative weight loss in favor, ironically, of the standard Whipple and not pyloric preservation. So if you as a consumer become wrapped up in this mini Whipple or pyloric preservation, the reality of it is that it really is not a major factor that should go into a surgeon's discussion when it comes to Whipple surgery. I thank you for listening to this medical tutorial, and I will continue to give more medical tutorials on the Whipple procedure.